Hanging from a bar is one of the most accessible and popular exercises, capable of positively influencing the spine while developing grip strength and surprisingly fortifying the arms. Many people report that by incorporating just 2 minutes of daily hanging, they feel more lengthened and exhibit a more upright posture, as the body's traction reduces natural compression between vertebrae and relieves tensions built up from hours of standing or sitting. When you hang, the intervertebral disc gains space, which lessens lower back pain and increases mobility. Simultaneously, deep stabilizer muscles around the scapulae and lower back are activated, promoting strength seldom achieved through everyday activities. Holding yourself suspended for 2 consecutive minutes intensively recruits forearms, tendons, and ligaments, enhancing grip strength and translating into better performance in other disciplines, such as climbing and weightlifting, as well as making daily tasks, like carrying or handling heavy objects, easier. The result is an involuntary stretching sensation and functional lightness that, while it may yield a few millimeters of height gain, has a significant impact on self-esteem and confidence when you stand before the mirror. This physical benefit is paired with an almost meditative effect, as focusing on breathing, inhaling deeply through the nose to expand the abdomen and exhaling slowly and fully through the mouth, helps calm the mind, reduce stress, and even improve sleep quality. To achieve the best results, it's important to start with a warm-up for the shoulders, arms, and wrists through gentle rotations and dynamic stretches. Progress gradually rather than immediately attempting the full 2-minute hang. Vary your grip, pronated, supinated, and neutral to stimulate different muscle groups. And always prioritize correct execution, avoiding excessive body swinging. With daily, mindful practice, you'll notice increasing bar endurance, healthier back muscles, and more defined arms. You can then explore advanced progressions such as active hangs, which add scapular contraction to slightly lift the torso, and combining leg abduction to intensify core engagement, ensuring a complete, safe, and effective workout for anyone, from beginners to the most experienced practitioners, turning just a few minutes of daily hanging into a powerful ally for health, posture, and quality of life. Prolonged spinal compression from long periods of standing or sitting leads to the gradual flattening of intervertebral discs, which lose their shock-absorbing properties and ultimately compromise both spinal health and overall quality of life. This degenerative process can cause chronic pain, stiffness, and even reduce the ability to perform simple daily tasks. But all of this can be prevented by adopting regular pull-up bar exercises. Simply hanging is one of the most effective ways to stretch the spine, reverse the effects of a sedentary lifestyle, and even become part of post-injury rehabilitation programs. The bar hang functions as a gentle traction that restores space between vertebrae and stimulates tissue recovery, contributing to healthier spines and more active lives. By lifting the feet off the ground and supporting only the hands on the bar, the entire body is subjected to a longitudinal force that almost instantly decompresses the discs and relieves pressure from body weight on the spinal joints, providing immediate relief from accumulated tension. With consistent practice, it also strengthens the muscles of the back, shoulders, and core, as the paraspinal, lumbar, and abdominal muscles activate to stabilize the torso, improving not only structural spine health, but also balance and body awareness. Many physical therapists and sports medicine specialists include bar hangs in therapy protocols and injury prevention programs because beyond lengthening and decompressing, the exercise reorganizes collagen and ligaments, increasing connective tissue resistance and elasticity, which reduces the incidence of strains and wear over time. Studies indicate that 30 to 60 second hangs performed 3 to 5 times per session are sufficient to generate positive adaptations without overloading the joints, especially when alternated with scapular retraction and protraction movements to train scapular motor control. For those looking to enhance the decompression effect, combining hip flexion extension movements while hanging can further activate the abdominal muscles and rectus femoris, delivering dynamic stretching that benefits the posterior chain and aids in myofascial release of tight areas. Meanwhile, grip variations, pronated, supinated, or neutral, target different forearm muscle groups, improving fine motor coordination and wrist health. Beginners should start with foot supports or elastic bands to reduce traction load, progressing gradually to a full hang. It's crucial to maintain rhythmic breathing. Inhale deeply and calmly through the nose. Exhale steadily through the mouth. To prevent breath holding, ensure adequate oxygen delivery to muscles, and minimize dizziness. Moreover, daily practice, even brief, builds a posture care habit, reminding the body to break sedentary patterns. Hanging can be done anytime, as part of a pre-workout warm-up within conditioning circuits, or as a micro habit during work breaks. It yields not only physical, but also cognitive benefits, since slight inversion and spinal stretching boost cerebral blood flow, enhancing mental clarity and stress reduction. Over weeks, as grip strength and endurance grow, you can explore progressions such as unilateral hangs or adding light weight via dipping belts to amplify traction, always heeding bodily feedback and avoiding sharp pain. After all, the goal is mobility restoration, not injury. Thus, bar hanging proves itself not merely as an isolated movement, but as a versatile spinal health strategy that integrates into prevention, rehabilitation, and performance optimization routines. With just a few minutes per day, you'll strengthen your spine, improve posture, extend quality of life, and rediscover the joy of staying active while restoring spinal health. Over the course of life, our height gradually decreases, a result of natural wear on the intervertebral discs and the accumulated spinal compression from daily activities. In this context, dedicating oneself to bar hang exercises not only helps prevent these age-related changes, but can even provide a slight gain of a few centimeters, as continuous traction assists in expanding the spaces between vertebrae, counteracting the natural shrinkage that occurs over the years. While strength training is indispensable for promoting muscle mass gain and improving bone density, many basic weighted exercises such as squats, bench presses, and pull downs impose significant compressive impact on the spine, compressing the intervertebral discs and, over time, fostering the development of bulges and small herniations that, if left unaddressed, can worsen and impair mobility and quality of life. This is why integrating bar hangs into your training routine creates a fundamental balance. While traditional weight loads work hypertrophy and strength, hangs provide active decompression, restoring vertebral alignment and simultaneously strengthening the posterior chain muscles, especially the paraspinals, lumbar, and dorsal muscles, which in turn offer more efficient spinal support, reducing injury risk during compound movements and improving overall posture. When you hang beyond the immediate stretching effect, there is an involuntary activation of stabilizer muscles that remain isometrically contracted to keep the torso steady, and this controlled tension stimulates positive adaptations in muscle and connective tissue, resulting in greater resistance to repetitive stress and heavy load movements. To further amplify these benefits, you can combine hangs with small lateral and front-to-back oscillations, producing varied stimuli that promote multidirectional mobility in the scapular joints and thoracic spine, while recruiting endurance muscle fibers rarely engaged in traditional workouts. Another important aspect is the positive impact on the central nervous system. The slight inversion and measured spinal stretch improve blood and lymphatic flow, aiding the nourishment of intervertebral discs and the removal of toxins accumulated in deep tissues. This can reduce chronic inflammation and persistent pain, often linked to poor posture and sedentary lifestyles. To apply this methodology correctly, it is recommended to start with short duration hangs, between 20 and 30 seconds, in sets of 3 to 5 repetitions, alternating with brief active rest, such as scapular retraction or suspended hip flexion, ensuring muscles remain engaged and technique is always prioritized. As stretching capacity progressively increases, the practitioner can incorporate varied grips, unilateral hangs, and even use a lightweight dipping belt, always monitoring bodily feedback and avoiding sharp discomfort, since the goal is to reverse compression, not to further overload the system. In the long term, consistent practice of this combination, training that induces compression alongside hangs that provide decompression, creates a virtuous cycle of strengthening, mobility, and regeneration. It enables individuals of all ages to maintain not only functional height, but also vertebral health, range of motion, and the integrity of joint tissues, ensuring an active life with less pain, better posture, and greater ability to face physical challenges. Whether high-intensity workouts or simple daily demands like lifting a heavy object or reaching items on high shelves. Herniated discs, often accompanied by persistent pain and even tingling, can be alleviated with proper pull-up bar hangs, provided the exercise follows a careful protocol that maximizes benefits without worsening the injury. To begin, place your hands slightly wider than shoulder width for balanced weight distribution and joint stability. Keep your legs either straight or slightly bent at the knees to reduce excessive lumbar stress, and adopt a natural posture that allows your spine and shoulders to relax fully, releasing any rigidity before starting the hang. Inhale deeply to expand the diaphragm, and as you exhale, let your body settle into the bar, activating your scapular muscles isometrically away from your ears. This scapular retraction and depression engage the lower trapezius and rhomboids, key for thoracic and cervical spine support, while simultaneously relieving pressure on the affected discs. Hold this position for 20 to 30 seconds during initial sessions, performing 3 to 5 repetitions with active rest intervals such as gentle hip oscillations or dynamic scapular retractions to maintain muscle engagement without exceeding your discomfort threshold. As your endurance and body awareness improve, gradually increase hang duration to 1 or 2 minutes per repetition, always monitoring for signs of sharp pain, tingling, or sudden weakness, which signal the need to regress or rest. You can also introduce variations such as active hangs, slightly raising your torso via scapular contraction to provide additional stimulus to stabilize your muscles and improve motor control, or unilateral hangs to develop muscular balance and intensely challenge the core by strengthening the transverse abdominis and spinal erectors. For those with symptomatic herniations, it's advisable to complement the protocol with gentle supine stretches, keeping the lower back relaxed on the floor, and pelvic mobility exercises like glute bridges to condition the posterior chain and promote interstitial fluid pumping for disc nutrition. Progression may also include elastic bands that offer partial body weight support, gradually reducing assistance as strength and comfort grow until a full unassisted hang is achieved. Prior to training, it's crucial to warm up the spine and shoulder joints with controlled rotations and dynamic arm stretches to prepare connective tissues for traction and prevent micro-injuries. Post-workout, apply myofascial release techniques such as foam rolling or handheld massage along the paraspinal and scapular regions to reduce tension points and accelerate recovery. Finish with static stretches targeting the chest and shoulders to foster global scapular complex relaxation and prevent future shortening that could overload the spine. To optimize outcomes, plan 2 to 3 weekly hang sessions, alternating with anterior chain strengthening workouts, modified push-ups and planks to balance spinal extension and flexion. Incorporate low-impact activities like swimming or Pilates, which complement decompression and strengthen deep stabilizers without axial loading. Never perform hangs immediately after intense pain episodes or acute inflammation without professional guidance, as the technique, though therapeutic, demands respect for individual limits and ongoing symptom monitoring. With this structured protocol, pull-up bar hangs become a powerful rehabilitation and prevention tool, capable of restoring spinal health, slowing the progression of bulges and herniations, and returning quality of life to those suffering from vertebral pain. When performing the hanging exercise to train the back muscles, inhale gently, and as you exhale, apply controlled effort, fully emptying your lungs to maximize activation of the paraspinal and spinal stabilizing muscles. Then, perform a deep head tilt by bringing your chin to your chest, which intensely stretches the upper and mid-back fibers, promoting flexibility and relieving accumulated tension. While holding this position, begin slow front-to-back rocking, using each movement to deepen the stretch and mobilize the intervertebral joint. When possible, enlist a partner to gently hold your hips and pull you downward, intensifying the traction and allowing you to achieve a greater degree of decompression. The goal is to hang for as long as your body comfortably tolerates, aiming for about 30 minutes of total hang time per week to balance arm muscle development with back muscle strengthening. To structure this time effectively, break it into short 3 to 5 minute sessions throughout the day, either after a strength workout warm-up or during work breaks, since multiple brief stimuli promote better neuromuscular adaptation, reduce excessive fatigue, and facilitate habit formation. During these sessions, vary your grip, pronated, supinated, and neutral, because each hand position changes the traction angle and recruits different muscle fascicles, fostering harmonious strengthening of the trapezius, rhomboids, latissimus dorsi, and spinal erectors. Beginners who cannot yet hang for 5 minutes straight should start with 30-second to 1-minute sets, resting briefly between them. As grip strength and endurance improve, gradually increase hang duration or introduce active hangs, which involve small scapular pulls while keeping the legs extended, engaging voluntary scapular contraction and refining motor control. Simultaneously, incorporate complementary ground exercises such as side planks and exaggerated back extensions, focusing on deep core muscles to adequately support the spine during hanging. Another valuable strategy is pairing hanging with thoracic mobility drills like lateral lying trunk rotations, so that upon returning to the bar, you already have promoted flexibility throughout the vertebral column. Regarding frequency, 2 to 3 hang sessions per week totaling 30 minutes, interspersed with strength or light cardio days, demonstrate consistent reductions in lower back pain, improved posture, and increased load capacity in compound lifts. To optimize recovery, finish each hang block with brief myofascial release using a foam roller on the cervical and thoracic regions, followed by stretches for the pectorals and anterior deltoids to ensure muscular balance and prevent front of torso tightness that can compromise alignment. Proper nutrition, consistent hydration, and intake of nutrients that support collagen synthesis and joint health, like vitamins C and D, omega-3s, and high-quality proteins, enhances adaptive gains and reduces inflammation. Finally, stay attentive to your body's signals. Any sharp pain, numbness, or tingling warrants immediate intensity reduction or temporary exercise suspension, and if needed, seek professional guidance. In this way, bar hanging, combined with active stretch techniques, grip variations, partner assistance, and complementary core and mobility work, becomes a comprehensive protocol not only for spinal strengthening and rehabilitation, but also for global trunk and upper limb muscle balance, promoting long-term vertebral health, training performance, and quality of life. Have you already incorporated bar hangs into your routine? Share your experiences in the comments. We want to hear how this practice is transforming your posture, your performance in chest and back exercises, and even your body awareness outside the gym. If you enjoyed this content, check out the next video playing on your screen now. There, we delve into the most common push-up mistakes and show you how to correct them to unlock your progress quickly and safely. The link is also available in the description and pinned comment. Thank you for watching until the end. If you learned something new or feel inspired to try this technique today, hit like, subscribe to the channel, and turn on the notification bell to receive firsthand all the new tips we've prepared for you, covering health, mobility, and performance that will take your training to the next level. Stay tuned, because there's much valuable content to come, from postural strengthening routines to active recovery strategies and functional stretching methods you can do at home without expensive equipment. We'll see you in the next video, where we'll continue this journey of self-discovery and well-being, helping you achieve a healthier spine, smoother movements, and unparalleled quality of life. See you soon.